Inward-focused emotions, suicide, Chapter 27. In some societies and culture, suicide is considered acceptable and even honorable. Western societies generally consider suicide as an inappropriate act committed by desperate or mentally ill individuals. According to Maslow's hierarchy of needs, safety and security are basic requirements for life. Individuals will behave in many ways to secure these needs. Some people respond with behaviors that promote growth, while others begin a journey down self-destruction. Most individuals communicate their intent. Therefore, every threat of suicide is serious. Many people communicate warnings of their intent by tidying up affairs, giving away possessions, or being preoccupied with death. Depression is a high risk factor for suicide, yet not all suicidal individuals are depressed. Mental illness is considered a risk factor for suicide. Suicidal behavior is the leading cause of psychiatric hospitalization for young children. Suicide can occur in children as young as 4 years old. For every successful suicide, there are 25 people that attempt suicide. According to the World Health Organization, they estimate that each year approximately 1 million people die from suicide. This represents a global mortality rate of 16 people per 100,000, or 1 death every 40 seconds. It is predicted that by 2020, the rate of death will increase to 1 every 20 seconds. In some societies and cultures, suicide is an accepted centuries-old tradition. For example, in Hungary, villages dwindle as the residents choose suicide over the uncertainty of living an isolated and lonely life. When people in Hungary get fed up, they hang themselves, cut their wrists, or swallow pesticides, just like their predecessors did before them. In Guam, the suicide rate is 50% higher than in the United States mainland. Suicide is an act of individual meaning. The actual reasons for choosing a final course of action are never really known to anyone but the individual that commits suicide. There are various motivations for suicide. Suicide may be considered a cry for help, a refusal to accept a diminished quality, style, or pace of life, a need to affirm the soul, to relieve distress. Patients or individuals may become preoccupied with suicide. It can be seen as a way to exercise control. There are life events that are linked to the motivation for suicide. If suicide is committed by a family member or committed by a friend, especially for the adolescent. A history of physical, emotional, or sexual abuse is often linked to suicide. After a suicide, the lives of the survivors are filled with questions, anger, sadness, shame, guilt, and health problems. Family members need to be included in the assessment of a suicide attempt for a client or a patient. The family members may provide some insight into the individual's behavior, especially if the individual is unconscious. There are various theories about suicide, that it is genetic, that there's a familial history, that those traits are born and bred, that because the problems are too big, people can't handle the problems, they don't have good coping skills. There are various theories related to suicide, but there is none that is a specific theory for why different individuals commit suicide. Suicide crosses all spectrums of the globe, from the rich to the poor, from the old to the young. Children are said to learn by exposure. The key to recognizing suicidal intent lies in a change of the child's behavior. Suicide is currently the second leading cause of death in 10 to 34-year-olds. There are various risk factors for suicide: abuse, neglect, exploitation, academic pressure, accident-prone, chronic or terminal illness, dysfunctional families, exposure to suicidal behaviors, family or self-history of anxiety, depression, family history of suicide, history of alcohol or substance abuse, inadequate child rearing practices, incarceration, prison or jail, living in a rural area, lack of access to mental health care, loss of a parent or a significant other, low socioeconomic status, poverty, homelessness, male gender, unmarried, unemployed, medications, member of a religious cult, mental health problems, negative outlook, previous suicide attempts, social isolation, stressful or unhappy personal relationships. Suicidal individuals are said to have a number of characteristics: a preoccupation with death, a sense of isolation and withdrawal, few friends or family, a distraction and a lack of humor, focus on the past. They dwell on past losses, defeats, and do not anticipate future. The concept of rational suicides is at odds with the current federal legal system in the United States. But there are 5 states that currently have assisted suicide statutes. Most elder adults view the timing of death in one of 3 ways. 1, God-controlled, 2, physician and individual controlled, or 3, controlled by the individual alone. Older males have the highest suicide rates within the elderly population. Various activities are associated with committing suicide: making a will, getting household and affairs in order, unexpectedly visiting friends and family members, purchasing a gun or hose or a rope, and writing of a note. The nurse needs to assess the potential for suicide and ask various questions. What has been the most difficult moment for you in the recent past? Are there times when death seems like an attractive option? Have you thought of harming yourself? If you were to harm yourself, do you know how you would do it? Do you have access to items that you would need to carry out your plan? Have you thought about or attempted to harm yourself in the past? What might keep you from harming yourself in the future? And the most important question to ask: do you think you can control your behavior and refrain from acting on your thoughts or impulses? The suicide assessment can yield valuable information about the individual's suicidal intentions, along with various clues from the individual. Suicidal ideation or thoughts. This is when individuals talk about wanting to be dead, imagine AIDS or other serious illness. They seem gloomy or brooding. A history of suicide attempts. An individual has tried to end their own life before. The existence of a suicide plan. The more detailed the plan, the more likely it might be carried out. The availability of the items to carry out the plan. Substance use or abuse. Suicide rates are known to be higher in individuals that abuse alcohol or other chemical substances. A level of despair, the ability to control one's own behavior. There are various problem statements related to suicide. In the physical realm, think of risk of self-disfigurement or rape trauma syndrome. In the psychosocial realm, think of impaired coping, ineffective denial, complicated grief, despair, helplessness, low self-esteem, impaired belief system. There are various suicide precautions. Determine whether the individual has a specific plan. Determine the history of the attempts of suicide. Remove dangerous items from within their environment. Place the individual in a less restrictive environment that allows for necessary level of observation. Place the individual in a room with protective window coverings. Observe closely during suicidal crisis. Escort the individual during off-ward activities. Demonstrate concern about the individual's welfare. Refrain from criticizing. Facilitate discussion of factors or events that precipitated the suicidal thoughts. Instruct the individual and others in signs and symptoms and the basic physiology of depression. Instruct the family on possible warning signs or pleas for help. Refer the individual to a psychiatrist.